Hi there, Stuart here from the Sports Therapy channel. In today's video we're going to be showing you a really nice symptom reduction taping technique to help with anterior tibialis pain, namely an anterior tibialis tendinopathy. The anterior tibialis muscle itself helps to dorsiflex and invert the foot and is vital when performing tasks such as walking or hiking and running, and it also helps to stabilise the ankle. Needless to say, with these activities performed, sometimes symptoms of overuse can start creeping in. Therefore, symptom reduction taping techniques like the one I'm going to show you now can be really helpful. So what do we need for this taping technique? Well, we need one long fibre strip of tape, one decompression strip with another optional decompression strip should we require it. So the first piece of tape is applied to the origin and insertion points of the anterior tibialis. Okay, so we're just coming around here just on the medial side. Okay, and just paper off tension, just literally guide the tape around over the tendon up into the anterior tibialis muscle, and then once you've done that, just a little bit of heat helps activate the adhesive. Okay, let's have a little move around just to make sure that feels okay. Right, for your decompression strips, and again with these it's always good just to round off the edges. I've mentioned that in a couple of our taping videos now. Just stops catching on clothing and just helps the tape stay on the skin just that little bit longer. So what we want to do with this piece is we want to just make sure that our foot's in like a neutral position, and we can just rotate it out slightly, just so if we're doing this technique ourselves it's just a little bit easier. Okay, so tear the tape in the middle, peel a little bit of the adhesive back, and now what we want to do is we just want to find that tender spot on that anterior tibialis tendon. Okay, and when we get that tender spot, what we then want to do is apply about a 60% stretch over that point, stick down, no stretch at the end. Okay, so we've got the stretch going on there, stick down, no stretch on the end. In some instances that may work rather well for you and that's all you need. However, if you do require the optional decompression strip, then what that can be applied to is like a crisscross pattern. So again, separate the tape in the middle, apply that 60% stretch over the area of pain. Just paper off tension as you come around the back of the foot. Again, paper off tension just as you come over the top of the ankle. And what that does then is that really helps lift that skin within the area, deloading the tibant tendon and offering you some symptom reduction relief to a anterior tibialis tendinopathy. I do hope you found that taping technique useful. I do use it quite a lot in my clinic when we see a lot of runners and hikers coming through with a little bit of overuse creeping in, and it's been used to really positive effect, so I can testify to that. However, I would always say it's always good to know what you tape in and why you tape in, because there could be a few other things going on, like a compartment syndrome in the area. There could also be a stress fracture developing, and there could be a peroneal nerve palsy going on, and if you haven't a clue what that is, then it's always best to get these things checked out with a sports therapist in your local area. Do feel free to like and subscribe to the channel. That's great, we're getting quite a few people on board now, which is lovely to see. But that's all from me today, so until the next one, I'll see you then. Bye for now.